Hi there, I'm Dr. Tina Pittman Wagers. I'm a almost retired teaching professor from CU Boulder. I'm a clinical psychologist, and perhaps most relevant to this talk, I'm a SCAD survivor. My SCAD was about 10 years ago. Since then, I've been involved in psychosocial research around SCAD. I helped develop the SCAD Warrior app, and I've talked to lots of SCAD survivors too. So I hope all that information is useful today. This talk really covers two topics. The first is, what do we know about some of the psychological factors around SCAD? And then the second topic is, what can we do to thrive? Sometimes, some days it's thriving, some days it's just coping post-SCAD. So when you survive a SCAD, there are so many things to get used to. Like the phrase, my cardiologist, like a bunch of new medications and doctor's appointments and tests, and even knowing what SCAD stands for. Most of us didn't know what SCAD was before we had one. Like the worry that you'll have another SCAD, like the feeling that your body has betrayed you. I can't tell you how many people have said something like that to me. And like the new post-SCAD reality of, your body being different than you thought it was, and all the psychological repercussions of that. So one of the most important topics to talk about when we talk about the psychological aspects of SCAD is to talk about stress. So we've known for a while that stress plays an important part of SCAD. So I'm citing research here that some of it stretches back to about 10 years that has pointed to the idea that emotional stress and other kinds of stress are very common precursors to SCAD. And that shows up in a number of studies, including ours that was published in 2018, where a number of patients rated themselves as having been at least moderately stressed in the year and 2 weeks prior to SCAD. If you've ever had a SCAD, you know that SCAD itself is also stressful. So even if you weren't stressed before SCAD, certainly the experience itself invites a lot of stress into your life. So this is some data from our study again from 2018, where participants reported SCAD as highly stressful, used words like scary, surprising, life-changing, traumatic, and uncertain to describe their experience of SCAD, and continue to worry about their heart health, even for some people years later. So why is SCAD so stressful? A lot of studies have kind of weighed in on this, but we know that SCAD often happens kind of out of the blue to otherwise healthy, younger, often female patients who the last thing they thought would happen to them is a heart attack. There's often, for a lot of patients, a lack of information about SCAD. What is it? What is this thing that I've been diagnosed with? I've never heard of this before. Where can I get good information about SCAD? Certainly a fear of recurrence. We know now that the recurrence rates of SCAD are lower than we once suspected. Even so, that's a worry on a lot of people's minds. Change in identity. A lot of people talk about the idea that post-SCAD, they see themselves differently and are seen differently by people in their lives. A lack of control, maybe a sense of, oh gosh, I couldn't have done anything to control having SCAD in the first place, and maybe feeling a lack of control of whether people can prevent a recurrence. A sense of isolation, partly because our diagnosis is so unusual that we feel isolated even from other cardiac patients. And then family stress. Lots of SCAD patients have experienced the need to kind of reshuffle roles and responsibilities and kind of reassess what they can do in their families to make things less stressful. So that comes from lots of studies. And the thing about stress is that it plays an important role in mental health more generally. When I describe the role of stress to my students, I say stress is the gateway experience to a variety of mental health disorders, but especially to anxiety, PTSD, and depression, which are certainly some of the most common mental health disorders and often crop up in this population of SCAD survivors. So stress is an important factor here. And one of the things that as SCAD survivors, we need to learn how to manage. I want to dive into some of the science around SCAD a little bit. So this is a study that is, often cited from Mayo, published in 2020. This is a pretty large study of 512 SCAD survivors, which found that 28% of these survivors had PTSD symptoms, 32 had depression symptoms, 41 had anxiety symptoms. Now, that does not mean that all of these patients had, full-on diagnosable mental health disorders, but certainly they had symptoms of these disorders, and those numbers are pretty significant. Here's another study. Now, this is a smaller study out of Canada, only 15 participants in this study. But what's notable about this one is that the difference between people who had a diagnosed mental health disorder prior to SCAD versus post-SCAD is almost double. So 40% reporting a diagnosed mental health disorder post-SCAD compared to the 20% pre-SCAD. So small numbers, but still a really significant study. This study from Australia looked at neuropsychiatric disorders. So that would encompass anxiety, depression, bipolar disorder, PTSD, any number of mental health diagnoses, and compared people who had SCAD to kind of more typical acute coronary syndrome patients. And you can see here that the numbers are quite discrepant, with the SCAD population having a much higher percentage of those disorders. This is a study that I'm pretty excited about. This just came out last month from a group in Australia who's doing a lot of really important work around psychosocial issues with SCAD. So in this study, certainly among these participants, and there were over 300 participants, there are high rates of anxiety and depression. No surprise there, really, compared to some of the other studies we've looked at before. But one of the things that this study did that other studies have not is they looked at psychosocial factors that are correlated with higher rates of psychological distress. In other words, what kinds of things were happening in these people's lives that might have made them more vulnerable to developing anxiety or depression post-SCAD. And those factors included absence of a close confidant, financial strain, lack of paid employment, younger age, pre-morbid mental health history. In other words, having a mental health diagnosis or history prior to a SCAD, and then not knowing other SCAD survivors. Now, this factor wasn't as significant statistically as some of the other ones I've mentioned on this slide. Still showed up though, and for a lot of people, that is certainly an important factor, is, the comfort of knowing someone else who's been through SCAD and has survived and maybe even thrived. So I was asked at the Sanger conference to talk about thriving post-SCAD, and I made a list. This is my wish list of, if I could talk about everything that I wanted to talk about, this is my list of things that I would cover. I didn't have an hour, I had a shorter amount of time. So these are the things that I focused on, the things that I've highlighted here. So this is what we'll talk about for the next few minutes: resilience, stress, post-traumatic growth, how to find a therapist, and the SCAD Warrior app. So resilience is something that has been discussed by another speaker, I believe. I use, I think, a slightly different definition of resilience. This is one that has shown up in the literature, including Southwick et al. Talked a lot about resilience in the 2014 study. But these are the elements of resilience, these four things, and I've got slides on each one. Recovering quickly from distressing events, focusing on factors within your control, emotion regulation skills, and cultivating positivity and meaning. So we'll do a little bit deeper dive into each one of these, starting with recovering quickly. Now, here's the thing. I really think that it takes people about a year to recover from SCAD, both physically and psychosocially. So I don't really want to pass any judgment about how long it may have taken you to recover from SCAD. It just takes a while. But maybe focusing on the next three factors will help you recover from distressing events should life throw you yet another curveball. So we'll kind of move on to the next three on the list. So the second one on this list is focusing on factors within your control. And I've got another slide on that. I don't purport to know everything that may or may not be in control in your own life, but when I was speaking at the Sanger conference, I talked about these things. Going to the conference and learning all you can about SCAD is something that participants had in their control. But also finding other information about SCAD, looking at the SCAD Alliance website, working with docs who have SCAD expertise, that'll help empower you and decrease the degree of uncertainty that you have about your diagnosis. Following recommendations around medications, activities, cardiac rehab, whatever your doctor has recommended, those are things that you can control, presumably. And then doing whatever else you can do to manage stress in your environment, in your body, vis-a-vis your thoughts. And we'll talk about some of those ideas in a little bit. Everybody's formula for how to know what's in their control is a little bit different, but those are some ideas. The third point here, and this is a little bit more complex, so I'll warn you, is emotion regulation skills, especially around negative emotions. Negative emotions can really hijack us sometimes and make things much worse than they might need to be. So let's talk about this for a minute. A lot of the skills that I'm talking about here were developed by Marcia Linehan, who's done a lot of work on emotion regulation. And I just cited one of her publications here from 2015, but she has really developed quite literature on emotion regulation skills. And we can down-regulate negative emotions through a bunch of different strategies. The first one is reappraisal. So anxiety, let me just use anxiety as an example because it's easy. Anxiety can show up and knock on your door urgently and convince you to feel nervous or anxious about something, even though that thing that anxiety is trying to convince you is so urgent happened like 2 years ago. So an example of how you can reappraise anxiety might be to just acknowledge, okay, anxiety has shown up here. It's knocking on my door. But it's talking about something that happened 2 years ago, not something that's relevant to my here and now. And so that's an example of reappraisal. Acceptance, certainly if you've had a SCAD, accepting that diagnosis and all that goes with it, including, the changes that you'll need to make in your life, et cetera, that's an important part of recovering. There are emotions that go along with that process. Maybe sadness, maybe some grief, maybe some frustration, maybe some worry. Accepting that those emotions are part of the package is almost always better than avoiding those emotions. Understanding that those emotions are part of the ride, they don't have to dictate your existence, but accepting that they're part of the experience is useful. Problem solving. I often talk to my patients about problem solving. And the key here is knowing, number one, is there a problem to be solved? And number two, is it within my control to solve the problem? It might be somebody else's problem to really manage or control, but sometimes there's a problem to be solved. Maybe you need a second opinion from another cardiologist. Maybe you need to communicate something to your loved ones about what you're going through in terms of your health. Maybe there's something that needs to happen with your work in terms of doing something to decrease the stress that you're exposed to there. But the first step is knowing, is there a problem to be solved? And is it my problem? The fourth bullet point here is attention redeployment. I'm going to go back to anxiety. You know how anxiety, depression too, can just demand our attention. And sometimes it's useful to know that anxiety has shown up, but it's also useful sometimes to redeploy our attention and make a decision. For example, I'm not going to be consumed by anxiety. I'm not going to ruminate over anxiety. What I'm going to pay attention to is this gratitude exercise I'm doing, or this task that I'm performing right now, or this person I'm having a conversation with. Whatever it is that is supporting my well-being, not detracting from it. Seeking social support. Oh my goodness, so important. Not even in just in the area of SCAD, but just in general. But certainly, though, the Murphy article that the most recently published article that I talked about a few minutes ago, that isolated these factors about having a close confidant, knowing someone else who's had a SCAD, really reinforces this point about social support serving a protective function vis-a-vis, anxiety and depression. And then deliberate attempts to change your physiology is also an important part of regulating emotion, because emotions have physiological components, right? And if we can calm ourselves down through mindfulness, through breathing, through exercise, through, whatever it is, there's a million possibilities here, that can really dial down the intensity of emotions too. I've got a slide on that one. Managing stress and calming physiology might involve managing the body, managing the environment, managing thoughts. I'm not going to go through all of that right now, but there is a module on the SCAD Warrior app if you want to learn more about managing stress in these ways that might be helpful for you. Finally, cultivating positivity and meaning. So to me, this really overlaps with the idea of post-traumatic growth. Tedeschi and Calhoun, cited here, started talking about post-traumatic growth back in the 90s. And it was the idea that after a traumatic experience, someone, not everyone, ultimately develops a different appreciation of life, renewed or stronger relationships with others, new possibilities, personal strength, spiritual change. Now, this doesn't happen all the time, and I don't want to peddle in shame or anything if this isn't something that you've experienced yet or ever. Maybe you're still at the stage of just trying to cope with the fact that you've just had a SCAD and trying to put all the pieces together after that traumatic event. But it is possible to come out the other side with maybe some of these new factors, the new characteristics in place. The more social support you have, the more likely that is to happen. So, going back to social support, boy, I really can't underestimate the importance of that. I want to talk about the SCAD app because I've referenced it a couple of times, and it's just really full of lots of different resources for SCAD folks. It used to be a freestanding app. Now, happily, it's on the SCAD Alliance website. So I want to shout out to SCAD Alliance and Catherine Leon for making that happen. You can go to the SCAD Alliance website and just put in SCAD Warrior, and the app will pop up. The app was developed by folks from a variety of institutions with a bunch of expertise on SCAD. So I want to thank everybody who participated in that project. And the app has been around for a while, but it has, I think, aged well. And it also contains a lot of the modules that are still reflected in the literature in terms of these are important for SCAD patients. So here's a list of some, but not all, of the modules that are on the SCAD Warrior app. You'll find information about diagnosis, treatment, risk factors, stress, values and meaning, interpersonal skills, communicating with health providers. Oh my goodness, that's important. Social media and SCAD. Spoiler alert, social media isn't always the best thing. Sometimes it is, but you have to be careful. Exercise in SCAD. Certainly important to talk to your own physician, but there are some good sound ideas on exercise in SCAD on the app too, managing chest pain, research in SCAD, and then sleep in SCAD. So check it out, especially if you were a newer survivor, but it also is useful for folks who've been coping with SCAD for a while. I want to say one more thing. We've talked a lot about anxiety and depression here and some of the mental health consequences of SCAD, and you may or may not be struggling with some of those things. But if you are and you don't have a therapist, here's some ideas about how to find one. I am a therapy provider myself, plus I train clinical PhD students as they learn how to deliver psychotherapy. And so this question comes up a lot. So here are some ideas about how to do that. Look at the ABCT website, talk to people you trust, your physician, your current therapist, ask them to provide some feedback on the names of people that you might have gotten. Pay particular attention if one name comes up more than once. Call a university-based therapy clinic or psychology department. They usually have a great list of referrals. Look for therapists who practice within organizations with cognitive behavior therapy or other evidence-based treatments in the title, and then interview a therapist. One more thing about this is that you don't necessarily need to see a therapist who has specifically treated another SCAD patient, but it is helpful to look for therapists who know how to treat healthcare conditions more broadly and are willing to learn about SCAD. So one of the things I was asked to talk about at Sanger was gratitude. I've cited this study here, Diniz et al. From 2023. And in that study, what these investigators found was that patients who practice gratitude, and that could be an easy thing, that could be just like listing 3 things every day that you're grateful for, did better with anxiety and depression symptoms compared to folks who didn't. So we'd encourage you to think about what you're grateful for, practice gratitude. There's lots of information on the internet about how to practice gratitude, but I just want to express my own gratitude today to the organizers of the Sanger Conference and the opportunity to speak with you today. Here's my email address. Feel free to send me an email if you have questions about anything that's in this presentation. Here's my references. The studies that I've cited, I'm just laughing because the print is so small, you probably can't read it. But if you have questions about any of the studies that I cited, I'm happy to provide that information as well. Thank you.